I'm not gonna lie. I remember his face so well. And I was crying with him. Even when every time I'm thinking about that, it makes me like, oh my, I want to die because it truly, sincerely impacted me tremendously. Seeing him smiling and sincerely crying, say multiple times, thank you so much to me, to my uncle. And I couldn't smile because I was aware of my teeth and now I can do it. But just seeing him talking with his teeth and smiling make my day. I was so happy to see him that day and it truly impacted me. And for sure I say after that is this is my profession. This is what I want to do. This is what I want to keep doing until the day I die.
Welcome to the Comfort Dental Podcast. Get a peek behind the mask with real people and real conversations.
Today, I could not be more excited that I get to be with Dr. Rosas out of Denver, Colorado. And Doctor, this whole podcast is all about the men and women behind the mask, the true heroes in Comfort Dental, and a little bit about more just like who they are. So my first question for you, Doctor, is why dentistry?
Well, I'm the seventh dentist in my family. I practiced in Peru for 2 years. Since early age, I like to work with my hands. I'm really into arts and do stuff with my hands constantly. So when I was a kid, I want to be an architect and I want to be an artist. But one of my uncle, one of my aunts, both of them married, and then both of them are practicing dentistry in Peru. Both of them they were saying when I was in high school, hey, I know you like to work with your hands. Back at that time, I want to be an architect, and then in my mind, I want to be a doctor. But they were the one who motivate me and say, you should try to do dentistry. At that moment, it wasn't in my mind at all. But I started helping them, being a dental assistant, and I liked what they were doing, and the impact that you create in people's smiles, and putting the smile back together, and giving a different perspective of life. It makes a huge change, and that created something in my mind, in my heart, and say, I think I should do this, and I love it. I truly love it.
So early on, you knew I'm an artist. I like doing things with my hands. And that's where maybe if you'd pursued the MD route, you wouldn't really get to be a surgeon. I mean, unless you chose that exact path. But I
Hmm.
love that every dentist not just gets to be a healthcare provider that knows about the body, but also gets to be the clinician, the surgeon that gets to be hands-on in the mouth. So on the spectrum of like scientist to artist, did you feel like you were more on the artist side?
Yeah, I was. Yeah, I would say yeah. That's for sure. I like to do aesthetic dentistry. At the beginning, now I do a lot surgery. My practice, I pulled a lot of wisdom teeth, and then I started doing implants. And I like that. I mean, I still doing what I want. Um, and even when I was in the dental school, I got an award for prosthetics. Uh, I graduated in Tufts in Boston. I don't know you're aware, but Tufts has the second biggest class in dentistry in the United States. So there were 230 dental students in my class, 200 of regular dental students and 30 international students, which was my case. Again, I graduated in Peru. I practiced it for 2 years. So I need to start do the whole thing back over again. And when I was at the dental school, I noticed I like to do prosthetics because again, you do a lot of stuff with your hands. And then I'm still doing that path, but at the same time still working doing surgery, which is something that I noticed recently that I like to do as well.
So after you graduated dental school at Tufts, did you stay in the United States?
Yeah, yeah, right. is for sure. I mean, I wasn't planning to go back to Peru. I mean, the student loans is too big. I wouldn't be able to go back and pay my loans over there. Um, so yeah. So after I graduated in Tufts, I came back and I'm still here in Denver, Colorado.
Was there a moment early on in your practice, as you're practicing, that you realized like 100% dentistry was the right decision for you?
Oh, for sure, 100%.
So tell me, doctor, what is it about what you get to do every single day that you love the most?
Put people back to smile again. We make a huge impact in their lives. That's for sure. And I can see that immediately. It's just when we deliver dentures, and patient didn't have teeth for a long time, and then suddenly they have it. Give that smile back again. It makes a huge impact, and that's what I like the most.
So could you tell me a little bit about your practice, kind of the community that you serve, a little bit about, I don't know, what might be unique that patients may not know about your practice?
Um, well, again, I'm located in Denver, Feather Jewel. I would say we look at like around 65 to 70% of the population are Medicaid patients. Um, and and that what that does is that we do provide a lot of uh, dentistry to people with low income. And then I'm here to help people. I'm not going for the money. And make the impact on people that unfortunately, um, can't afford to have private insurances, and having the Medicaid. And now here in Colorado, the state helps a lot to the people that have Medicaid. We provide everything that can be done, from simple restorations or fillings, dentures, extractions, dentures, either partial, complete dentures. So we do everything on the patient and say we're not looking at if the patient can afford it to do it. It's just, we just do it, and and that makes me really happy. I mean, it's going back to serve the community is what I want to do since start practicing back in Peru and here.
So you get to see a lot of individuals that really need dental care. It's not just elective, it's not just like a nice to have, it's a must have. And yet they can't always afford it because of the demographics of the types of patients that you see.
Hmm.
So you're saying you love the fact that given the comfort dental model, you're able to see everybody.
For sure.
So
Absolutely.
accessibility of care is one of the things that your practice
Yeah,
very proud of.
that's for sure. This is one of the things that I liked a lot from Comfort Dental. I do have some of my classmates. They are in different states, and some of my colleagues are here in Colorado now working for Comfort Dental. And the main thing from Comfort Dental is that we take all the private insurances and state insurances, the Medicaid. And some of my colleagues that don't take Medicaid, they don't take, unfortunately, because they say, they don't get paid well. Sometimes it's inconvenient to deal with insurance, that kind of stuff, which is different with Comfort Dental. Comfort Dental takes all the type of insurances. So we're not looking for the money, we can say. We are looking for helping people, no matter if we get paid, $100 for a filling, or we get paid $70 for a filling. So we are here to help instead of, looking for the money.
I think that's just amazing that you as a dentist gets that gratification of knowing, hey, I'm here to help people. Doctor, could you walk me through what a first visit looks like at your office? Like what should a new patient expect?
I know every dentist practices in a different way. Me particularly, what we do is in general is besides taking full mouth X-rays, We sometimes I take intraoral pictures just to let the patient and the insurance know what the patient really needs. Because sometimes with experience, if we just send an X-ray to the insurance and say, "Hey, the patient needs to get a crown," sometimes the insurance they need to have um, more information why the patient needs to get a crown for them to approve them. Um, and then that's why I'm saying now a lot of dentists take intraoral pictures. It's not mandatory for the American Dental Association, but I do just to avoid problems. At the same time, I think it helps for the patient to visualize what I'm looking. And and again, I practice a little bit different than other dentists because I like to show the extras to the patients to say this is the reason you need to get a root canal, you need to get a filling. So I explained a lot more. My exams take a little bit longer than in other offices. We can say that. After the extras, I'll take like about 10 to 15 minutes showing the extras to the patient, showing the pictures to the patient, like intraoral pictures, while they then grab with the mirror so they can see what I'm looking at, and then explaining what they need, give them options. So I might suggest, we can save the tooth, but sometimes the patient say, well, I don't want to save it. I want to go a different route. So it's an interaction between me and them, give them options. But at the end, um, I'm just an employee, I said to all the patients and joke around with them, say, hey, you're the boss. Whatever you want to do, that's what I'm gonna do. As separate type of stand, we can say that because if the patient wants to say, "Nah, I just want to pull all my teeth," and I see they have solid teeth, they're good. I was saying, "No, don't do that." So I mean, there are some limitations. If we can say that. But I like to interact with the patients, explain the options, and then at the end they make the decision.
You know, for some reason, because of its dentistry, you often have patients that might be a little apprehensive or nervous or anxious coming in. Um, is there anything you do differently to try to put those patients at ease?
I mean, yeah, sometimes if I feel, or sometimes they say I have a little anxiety, I hate to see dentists. Try to see why and give them options. Um, you know, Sometimes I tell the patients, you can put your headphones on and listen music when I work on your teeth. So there is interactions all the time, to see what we can do medically or with just, listen music or I have like a ball they can squish, when and give it an aesthetic. I mean, I do have different techniques that I've been learning. When I was back in practicing in Peru, working as a dental assistant, practiced as a dental assistant for 11 years before I went back to the dental school here in the United States and before I started practicing. So I learned a lot because during that time I worked as a dental assistant here in the United States. I worked with easy with more than 15 dentists. And the reason I'm saying that is because the majority of comfort dentals, probably you don't know, the majority of comfort dentists have either between 2 to 4 to 5 dentists per office, per practice. So when I was working in those offices, I worked with 3 or 4 dentists at the same time. And I was working during the weekends because I worked in another office full time. We specialize in just HIV patients. It wasn't a nonprofit. So during the weekends, I was working for Comfort Dental, and that's why I learned a lot from just looking at different dentists, learning their techniques, what we can do to help the patient to feel comfortable during any type of procedure.
One thing about dentistry is it's a frontline healthcare vocation, meaning like you are directly interacting with patients, and patients come in with all sorts of preconceived ideas, or possibly they're in a lot of pain, and you don't always know what's going on behind the words that they're saying. That I don't know. How do you view the patient interaction? Is that something that you like the challenge of it? You love just dealing with people? Because, some dentists prefer to just be chairside, and they actually have anxiety about, oh my gosh, I'm dealing with another person. It
Mm,
doesn't seem like you have that at all.
no, no. I mean, sometimes I had the feeling where, they're nervous. So um, I talk a lot. All my employees, all my assistants say, like, we cannot stop you when you're talking. And I like to do that with patients because I feel, that helps them, to calm down. It's not, I try to be not just a provider. I try to be, if it's possible, like a friend. When I'm waiting for the anesthetic to kick in, to have interaction. Say, "Hey, tell me a little about your life," and we joke around. Obviously, my first language is Spanish, so when I see Spanish speaker patients, the interaction is a little bit different. And I like to have that connection with any type of patient. Try to be friendly, and when I feel the anxiety is try to joke around. It's like I don't know. It's so putting like a small smile when they before they receive the shot or after. I think it makes the change. Sometimes I get nice compliments when I give it anesthetic. They say, "I didn't feel it. You're the best." The whole thing. I don't want to brag about a lot about that, but
No,
it
that's good
makes
to
me
hear.
happy. It makes me happy because that I feel the patient, is loosening it up. They're comfortable, and I can tell because they return. They come back to see me, so it's not just phrases. It's like I feel um, that we get a connection, and that's extremely important for me. If they're happy, every time they're gonna come, we're gonna have a good time.
Okay, so going back to what you said about them giving some good feedback, um, kind of capturing what it is that they are saying is really, really important. Like, are there other common things you hear after a patient's first visit, whether they remark on the affordability, whether they remark on, I don't know, just the, wow, that was quicker than I thought, or is there
Mhm.
anything that you're commonly hearing when that people kind of remark on after a visit? It doesn't have to be a first visit.
No, I would say for walk-in patients, which is, is patients they don't make an appointment, they just show up, or even people that make their appointments ahead of time. Um, I would say 30% of my patients, no, yeah, 30% of my patients, they come because they want to pull their teeth, especially wisdom teeth. And I'm fast pulling wisdom teeth the majority of the times, and then I receive nice compliments. It's wow, I took like it's technique, but only like for upper wisdom teeth, I would say I take only 2 minutes. And then so they say that all the time. We're like, and I joke around with them, and it's just like, hey, if I take less than five, this will be for free. And there's like, and then boom, and comes out. And then they say, "Oh my lord, you're amazing. I didn't feel it. You're a lot faster than I was expecting." And then I like to call them back after the procedures. At the end of my day, when I finish catching up with my notes, I call the patients, no matter they're for extractions or root canals or restorations. I like to call them and just to check on them to see, hey, how was the procedure? Now that you're not numb anymore, any questions, that kind of stuff. And I do receive a lot of compliments and say, you pull my wisdom teeth. That will be a lot worse. I heard that, those kind of comments constantly, and I don't have no problems. You pull all my wisdom teeth in less than 5 minutes, and then I mean I'm so happy and I'm no pain. So that takes it makes me happy as well. you know. So I mean, receiving that feedback and a truly feedback, not because they're in front of me. I'm calling them, after a few hours, and they repeat that, and and that's just nice, and sometimes I heard that from my front staff. They say this patient walked out after you finished with the procedure, and he said you're super nice, you're friendly, good with anesthetic, that kind of stuff, and that's a nice compliment, and it makes you feel good at the end of the day, like you made a change on the patients, and you take the pain away, and now they're happy.
So, so for the patients that maybe don't know much about Comfort Dental or your practice, and maybe they're just scared because they're like, man, I just heard dentistry costs a ton. Um, what would you say to them, or what options do you have to possibly address, affordability of care?
Mm, Well, gold plan is now it's called Cleary plan. It's something it's a discount plan that all the comfort dentals provide. So it's an alternative option when patients don't have insurances, and they want to get a treatment plan. It's a plan that gets a discount plan, where at least here in Colorado, they pay $150 for there's one-time payment, $150 for the whole year, and they get a discount either between 30, 40% off of the actually, uh, cash price or full fee should be. So they do get a lot of discount, and it's easy. It can be thousands. It depends on what they want. So it's very affordable. You know, get dentistry with comfort dental offices.
Do you often hear patients are, I don't know, maybe shocked either by what it covers, or how affordable the gold plan is?
Yeah, multiple times is when they go to on their change or private offices, and then they say, oh wow, I mean, comfort is amazing. This is affordable, because they get the same quality they can get from private offices, not comfort dentals, and dentistry is now it's not a luxury anymore. It can be accomplished with without thinking, can afford it not. We offer payment plans. There are different credit cards they can apply for medical and dental, and then so we give option for the patients when they wanna do their treatments and everything they want to get done.
Um, so I'm just thinking again from the patient perspective, when they hear about how affordable it is, do they ever look like, wait a second, this seems too good to be true? Like, how can I have good quality and at a good cost? Can you tell that they ever seem like a little, I don't know if it's suspicious, but a little like, I don't know, maybe doubtful that they can get both?
Not necessarily. I mean, not at least with my experience. I never heard anything negative and says, is that true? I mean, how come that's that cheap? Or make negative comments and say is that, I mean, because I'm paying not that much, like ne- getting done in a private office is less quality. No, I mean, I think they can tell after work is done, because if there is an issue, like not just with in dentistry, you have an issue, you will go back to the office and say, I'm having problem with these tools after you worked it on, then no, and they don't come back. uh it says that this not good. I mean, there is an issue, um it can be resolved. I mean, the common problem after you do restorations is, it could be because the bite is high, which is easy to manage because when you're numb, we place the fillings, and then we check the bite before you walk out. Um, but if you make a small change in your bite when you're numb, um, is hard to tell when you're not numb anymore. And when the numbness wears off, is when you can tell the bite's right or not. And then it could create pulse sensitivity sometimes, but sometimes it's common. But most of the time, we tell the patients, "Hey, you see having problems, come back and we make adjustments." And I would say most of the time that resolves the problem. So no, I never heard anything negative about receiving negative comment from patients saying, "Hey, this is too cheap to believe" or something like that. No.
How often do you get patients that are coming in either for a second opinion because they got a quote for treatment somewhere else in the community, or they're coming to you because they couldn't get seen for whether it's weeks or months somewhere else?
I mean, getting second opinion, this is common. I mean, this is doesn't happen all the time, but yeah, we do see some patients come back from their offices. But this is they are supposed to get this done. I mean, we checked, and we have a discussion about the treatment, what I see, and then we explain that to them, what they need to get done. Um, that's is common. It doesn't happen all the time, but I would say only. I mean, as far as I know, the patient will say that to me. They say, "I got a quote from another office, and this is what they told me." But I would say that happens only happens like 5% of the times, at least with me. Or saying they saying that to me. Probably they say that to your receptionist, but they don't say that to me. So it's just now it happens all. It doesn't happen all the time. So,
And then in terms of being able to be seen same day.
oh, that is the other part I like from Confident a lot. The majority of private offices, they are open from Monday to Thursday. It's only work, 4 times in 4 days during the week. Confidentals open from Monday to Saturday. And during the week, we open the doors at 7:30. In the morning, we close at 7:30 p.m. That's from Monday to Fridays. And Saturdays, it's from 7:30 in the morning to 1:30 p.m., which is very uncommon here in Colorado, where, patients can see a dentist during the weekend. Yeah.
So if there's a patient, doctor, that's been avoiding the dentist for years, because of cost or fear, what would you want them to know about walking into your practice?
We're going to do as much as we can to release or help with the stress and anxiety. We're going to help them providing, options for payment plans. We're going to offer again the gold plan to help them with, getting a reduction in their treatment plan cost. I mean, we're going to do as much as we can to help them in whatever they're afraid of or they're concerned, to help them to get their work done and put their smile back in.
So what's the one thing you wish every patient understood about taking care of their teeth?
It's never too late. They need to, brush, floss, do their part, and we do the other part for them. Help them release their pain and help them to put their smile back again. And it's important, the communication, and see what they want to get from us, and and help them as much as we can.
What do you feel like are the biggest misconceptions that patients have about dental care?
I would say pain is the major problem. They believe seeing a dentist will produce more pain, which is not. Then I understand, the shots. Getting the shot is, I think, is very common factor. Patients says all the time. But there are techniques, Um, what else is the drill, the sound? Um, Obviously, unfortunately, we cannot take away the sound, but it can help, using some. Uh, I mean, if the patients don't want to hear, the drill, tell them, hey, you use your headphones and listen music when we're working on your teeth. Um, I don't know. I mean, I have some patients where, unfortunately, they have a bad experience when they were kids, and they don't like to see dentist. That's called lab coat syndrome, when they're afraid to see a dentist. Or but I try to see what is the reason they have the problem, and try to figure out what I can do to help them. um, I like to um, give the option to the patients sometimes, uh, providing is diazepam, like a tranquilizer, or to release anxiety could help. Um, but personally, I would prefer if we can go in another round. I don't like to prescribe medications. Um, I try to avoid it, because I know it can be accomplished in other ways, if they're afraid about something specific. But yeah, that's me.
Okay, so I'd love to know a little bit more about your team and just kind of the culture in your team. You mentioned that your team says about you, oh, Dr. Rosas, he talks a lot.
Yeah.
He's always spending time with the patient. Maybe his exams, run a little bit longer than normal. But just tell me a little bit more about your team and the way that that culture is.
Yeah. Again, my office is in South Federal. I would say 60 to 65 of my populations, I mean, my patients are Spanish speaker patients. I do have three girls, bilingual receptionists. Then I have for five dental assistants, and all of them are bilingual. Besides me, I am from Peru. The other dentist in my office, his name is Dr. Farah Machi. He is from Honduras. He graduated in Chicago, but he did a regular program, so the whole 8 years. Versus me, I got in the international program. I completed in the last 2.5 years in the Tufts program, in international program. But we merged with the regular class, and so my whole office is bilingual. Um, mm, I mean, that's just one of the things that's not so common. In other comfort dentists, we can say what everybody speaks Spanish. Um, I mean, I worked again in a few offices, as I mentioned that in the past, where I would say only 20% of the staff, including the dentists, were bilingual. Not everyone, like my office. So yeah, I would say it's a huge difference for sure. So it's a lot easier for the patients that are Spanish speakers, to communicate whatever they wanna ask in regards to the treatment plan, to option for payment in their native language, without having somebody translating that for them. So this is, I think I would say that's the major characteristic from my office, from other offices potentially. But yeah.
When it comes to like the essence, or you could say like the vibe of your practice, is it one that is mainly serious? Is it one that's mainly, I don't know, lighthearted? And like, would you describe it as being an office that's fun? Like, how would you describe it in terms of those types of descriptions?
For sure. I mean, we try to joke around with patients when it's possible. If we feel, they're afraid of, see a dentist or something. We're not a common office where, this is what you need to pay and okay, leave, that kind of stuff. Or in my case, this is what you need to get done, and I don't explain that to them what they need to get done. I mean, it's just, I like to take my time with the patients, respect um, their time, um, but is it. I think we try to make it, comfortable as much as we can for the patients. That's why it's called comfort dental, because we like to make everybody patient comfortable.
Are there certain procedures that you do, doctor, that maybe, I don't know, patients may not know, like, wow, this is a procedure that can be done at this location?
Yeah, I been doing aligners now. Started doing aligners, which for patients that don't know what it is that it's another alternative option for moving your teeth besides braces. If the patient wants to get braces, I'm referring it to the orthodontist. But for this is more for the patients to know. Um, Braces most of the times is for patients from moderate to severe malposition of the teeth, versus the liners is more for easy to moderate cases. So not all the patients can go with the liners. Same for the patients to know that the aligners are similar like clear retainers, if we can say that. There are trays, clear trays that you need to replace it either weekly or bi-weekly, and they help them, to move your teeth. Um, so yeah, I've been doing that. It is nice. It's an alternative option when move your teeth without having the metal pieces, on every single tooth, and you can accommodate all your teeth and put your smile back together again, having straight teeth.
So to our listeners, I get instantly insecure the second I hear that I'm talking to someone that does some sort of ortho, because I have a
Yeah,
little gap in my teeth. Would I be a fit for aligners, doctor?
I mean, I will need to evaluate your case. Take intraoral pictures, scan, and see and check your bite, what type of bite you have. Because again, not all the patients could get the liners. If it's just a minor space in between your teeth, yes, that can be fixed with the liners. But again, it needs to be evaluated by me and then decide if it can be a good option for the liners, or I need to send you to the orthodontist to get braces.
So I know also not every GP does implants. How long have you been placing implants?
I start doing it for, I would say, no more than a year. I'm about to take a class. I'm going to Brazil. I like to take implant classes. Um, Going to Brazil in May, from May 20 to the 23rd. I'm staying there for a week. I'm going to be placing between 20 to 25 implants during that week. So it's something just started doing it. Um, but it looks fun, and it looks something that for sure I want to do, because I like to do surgeries, and so I'm excited about that.
Is this the artist in you that's always wanting to learn more, explore, figure out a new procedure?
Yeah, that's it. That's for sure. So when I was working as a dental assistant in helping a bunch of dentists, some of them were placing implants, and I was curious, how they were placing it, and looking the procedure, and and in my mind says, well, okay, eventually I'm gonna get my license back here in the United States, and then after that I want to do that. So when I was when I was a dental student in Tufts, whenever I could, I was shadowing, going to the oral surgery department or the periodontics department, to help the dental students in those specialties, when they were placing implants, to learn and to feel more comfortable. So whenever it was my moment, to place implants, I will feel more secure. And I'm excited for sure, what I can do, and placing implants is it's a great option when you want to replace your teeth. and it's very affordable. It's very affordable. At least in Colorado, the implants are about 3,000, and that is the implant and the crown portion for most of the times. That's not including sinus lifting or bone graft if it's needed, but that's very, very affordable here in Colorado. Again, I have a few colleagues that are not working for Comfort Dental, and I know the common cost here in Colorado for implant in the crown is between 5 to 6,000. In Comfort Dental, is only 3,000, and that's implant in the crown. So this is it's very affordable. Uh, I like that part a lot. So we can provide a great option, for replacement teeth.
Wow, yeah, that is amazing. Doctor, is there anything about where dentistry is headed, whether that's the technology side, that you're just excited about in the upcoming years?
Um, I would say something is been changing a lot is technology. It's changing constantly all the time. Um, is the in the past to take impressions was just using different impression materials. It's called silicone or PBS. We call it PBS. And now you scanned. So and you get the final result a lot quicker from the lab when you scanned versus taking regular impressions. At the same time, I mean, not just Comfort Dental, but something is new, not completely new. I would say like no more than 8 years. Is or which is very affordable now. It's called CBCT. It's a three-dimensional X-ray where you can see where the nerves are, so you can see actually how much space you have between the bone and the nerve before you place an implant. And there is something in the market now. It's called lasers, where you can do dentistry, and getting gum surgeries using the laser without, using the blade. We can say that, to cut the gums, and it is amazing. I mean, technology changing constantly, materials is changing constantly, and yeah, I'm very excited to see it will happen in the future. Um, so yeah, this dentistry is amazing. Every time I talk about dentistry, it's I can't stop talking, but yeah.
So on the patient side, I'm curious, doctor, can you think of a patient story where for some reason it's memorable, whether it was something that they remarked on, whether it was something about the transformation you were able to give or the smile that you were able to restore, anything along those lines?
Mm, well, is when their smile, in combination what they want and what they can afford. I mean, sometimes it's a combination of different specialities. Because sometimes it's I don't have enough space. I need to talk to send into the specialist, where they need to cut a little more portion of the gums and the bone with the perio specialist for me to have the right length for the crown, to get the smile they want. Um, so but unfortunately, again, it will require more of, like normal treatment, we can say that. So if we work based off what they want, what they can afford, to provide what the best result can be done based off, their financial situations. Um, but if there is something else they would like to manage, if I can do it, I refer them. But yeah, nothing specific.
Okay, so but is there like um I don't know, like if you've ever had a difficult day in dentistry where you're driving home and you're like, man, today was a little tough. Is there like one patient story that comes to mind where you're like, man, that's the reason I do dentistry. It's for patients like that. Because I know not everyone is positive and not every interaction is positive, and sometimes as a dentist, you have to remind yourself why you're doing it. Is there a patient story that comes to mind?
Yeah. Um, Back in Peru, when I was working with my uncle, my aunt, both of them were dentists. Um, One day I was helping them pulling the teeth. The patient need to get full denture, stop at the bottom. Their teeth were really in bad shape, and unfortunately, it could be not be saved. So he need to get all his teeth extracted. Um, so we made the dentures ahead of time, and we had the dentures already made before we pulled all his teeth. Um, some is his, some of his front teeth, where we can say somehow uh, solid, but they have a lot of mobility because the patient lost a lot of bone. So those teeth cannot be saved. But if you see him, smiling, the teeth we can say up front were solid. I mean, without caries, but no bone. You know, so the teeth need to be pulled. We pulled all the teeth, and then we put the dentures in, and then it made a huge change in his smile. Having all the teeth with no caries in the front teeth. I mean, there were no caries, but they were not mobile anymore. But having the smile of top and the bottom teeth complete, the patient, when he put it in or put it in, and he looked at himself at the mirror, he started crying, and then says, "Oh my Lord, I'm so happy." I mean, and I'm not gonna lie. I mean, when I remember his face so well, and I was crying with him. It's like says, "Oh my Lord." Even when every time I'm thinking about that, it makes me like, oh my, I want to cry, because it truly, sincerely impacted me tremendously. Seeing him, smiling and sincerely crying, and say multiple times, "Thank you so much to me, to my uncle." And like, and says, I mean, I'm happy. And his smile was embarrassed, uh, I couldn't smile because I was aware of my teeth, and now I can do it. I want to be able to eat without thinking, I want to lose, some of my teeth can break more, that kind of stuff. But just seeing him, talking with his teeth, and smiling, it, it made my day. And I was so happy to see him that day. And then it truly impacted me. And for sure, I say after that this is my profession. This is what I want to do. This is what I want to keep doing until the day I die. It's just I'm not planning to retire anytime soon. I mean, is even when my hands are not capable of moving. I mean, I wanna teach if it's possible. But for sure, dentistry is a beautiful profession, and I cannot stop talking about dentistry. But I know sincerely, this profession is beautiful, and it can make people's life change drastically. And I saw that, and I truly remember that day. I can start crying right now. I mean, it's just, I'm so happy doing what I'm doing now.
Okay, so as we're wrapping up, I just have a few more questions. What is one word your patients would use to describe you?
Friendly. Yeah, friendly, for sure.
Okay, what makes you smile outside of dentistry?
Mm, Spending time with my family, with my kids. Um, I have two kids. My son is 15, my daughter is 11. And then I like to cook. So when I'm at home, I like to cook, and I like to make Peruvian food. And when I see them eating, and they give me compliments of that, this is so good, the whole thing. And, and it makes me happy, and seeing my kids, smiling, enjoying what I make, and is for sure. family is extremely important for me. You know, is yeah, I think for all of us. And yeah, that's for sure. My family, it's something makes me happy.
Okay, so if there's a special moment that you guys are wanting to celebrate and they're like, okay, dad, we want dad to cook, what is the meal you make?
Well, it depends. If it's my daughter, uh, she loves seafood. So she wants me to make her something called tiradito or ceviche. It's both of them are Peruvian dishes made with fish. If it's my son likes steak. So he wants me to make lomo saltado, which is another Peruvian dish. It has French fries, onion, that kind of stuff. If it's my wife, I would say is um, she loves ají de gallina, which is a chicken dish. It has a yellow sauce and that kind of stuff. So yeah, and my wife she's American. I met her back in Peru. So is that she? I mean, my whole family loves when I cooked, but it depends. Who's requesting what they want me to make. But yeah, I enjoy cooking for sure.
So if someone's not used to Peruvian food, would they describe it as spicy?
Well, it depends. I mean, I love spicy food. My everybody in my family is familiar with spicy food, but I would say it's not spicy, spicy, spicy. I mean, I try Thai food. That for me, that's extremely spicy. When you say spicy, like, oh no, I can't handle that. When it's like authentic spicy Thai food, no, that for sure is spicier than Peruvian food. Um, but when we have friends, neighbors, I never heard from them saying, it is spicy. But I don't know. I have a few Central American friends, and even when you use black pepper, they say it's spicy. so, so it depends. It depends.
Okay, so final question. If a patient right now is listening and they're thinking about scheduling their first appointment with your practice, what would you say to them?
Well, you're welcome to come anytime to our office. Again, I'm Dr. Rosas. Please make an appointment with me or with Dr. Farah Machi. You're going to have a great time. You are a Spanish speaker patient. Bienvenidos. Estás invitado a nuestra oficina. And then if there's something that you're afraid of, please feel free and comfortable anytime to mention that to us. It will make the experience comfortable for you here at Comfort Dental South Federal.
Dr. Rosas, it has been so evident to me that you as a care provider, that it is so genuine. Like it is through and through just in you. And that's why it just comes out of you that you absolutely love and are committed to making people's smiles be transformed, to really taking care of their oral health. And one thing that stood out to me is your willingness to spend time with the patient to make sure they really understand what's going on, to make sure they really understand what their treatment options are, and that they're the boss, as you said, and you're going to do what it is that ultimately they want after you've educated them, after you've given them all that information that they need.
Mm-hmm.
I couldn't recommend your practice enough, just even based off of your care philosophy. But I just want to say, like, it has been an honor, and thank you so much for letting me interview you today.
No, thank you. Thank you so much for your time as well.